Hello and good evening, everyone. Welcome to PMP Live. My name is Brittany Kerfoot. I'm the Deputy Director of Events at Politics and Prose, and I'm so glad to see all of you here on this Friday evening. At any time during the event, you can click on the green button below to purchase tonight's book straight from PMP's website. And a reminder that we're offering $5 flat rate shipping on all orders, no matter how many items you add to your cart. You'll pay the same price. Additionally, if you live in the DC area and can get to one of our stores easily, we're offering curbside pickup at all 3 of our locations around the city. And that's at no additional charge. So just indicate in the comments when you order your book where you'd like to pick it up. And I've also added a link to Cecile Richards' book in the chat. It's the first link up there. So that will go straight to our website if you'd like to order that book as well. Also, you can ask either of our speakers a question tonight by clicking on Ask a Question, which can be found at the bottom of your screen. And you can even vote for questions you would like to hear answered the most. Finally, and most importantly, I just want to thank everyone for being here tonight, as the issue of women's rights is increasingly crucial, and it's books and conversations like these that keep the issue at the forefront. Education is key, and I hope you'll also be able to read a copy of this book as well as Cecile Richards' book, because they are both utterly enlightening and ultimately so important. So it is now my pleasure to introduce tonight's speakers. Diana Greene Foster is a professor at the University of California, San Francisco in the Department of Obstetrics, Gynecology, and Reproductive Sciences. She's also the Director of Research at Advancing New Standards in Reproductive Health. An internationally recognized expert on women's experiences with contraception and abortion, she is the principal investigator of the Turnaway Study, which is the title of her latest book. In conversation with Foster tonight is Cecile Richards, a national leader for women's rights and social and economic justice. As president of Planned Parenthood Federation of America and Planned Parenthood Action Fund for more than a decade, Richards has worked to increase affordable access to reproductive health care and strengthen the movement for sexual and reproductive rights. So now please help me welcome Diana and Cecile onto your screens and to PMP Live. There we go. Uh-oh, Diana's video. Diana was so worried that something would happen, and now I can't.
We'll get her back. We'll get her back.
And now her video is stuck. That is, oh my gosh, she worried for a reason. That's awful. I will extract that. Oh, there she is. Okay, it's all working. We got the glitch out of the way. We're good to go now.
Pandemic miracle. We did have a long conversation before this started about what happens if the technology doesn't work, but I know everyone's used to that these days. It's really exciting to be here with you, Diana. Congratulations on getting this book published.
Thank you so much.
Yeah, I know it was like a Herculean effort, I think 10 years of research. And so anyway, maybe we'll just start out from the beginning for folks who don't know a lot about the book, but what motivated you to write this book?
So this book is really written to try and empirically test the assertion that abortion hurts women, which is an idea that has motivated hundreds of state laws that are designed to protect women from making this decision on the idea that they might feel regret or have a mental health problem after. And the idea made it all the way up to the Supreme Court, with Justice Kennedy saying that he thought that it was reasonable to assume that women would experience regret and be depressed. But he admitted at that time that there was no reliable data. And that was exactly the year that a team of scientists at UCSF started this study to try and look at what are the consequences of having an abortion. And the real reason why it hasn't been answered well is, who do you compare them to? Who do you compare women who have abortions to? Well, the reasonable comparison group is people who wanted an abortion and couldn't get one. And so that was the design of this study, is to compare people, all of whom wanted an abortion. Some of them got it and some of them didn't, and follow them through time.
I mean, the stories in the book are incredible. I hope everyone's seen it, the Turnaway Study. And I actually, if it's okay, I just wanted to like kind of put a fine point or underscore what you just said about the 2007 Supreme Court case. We were talking earlier about that was actually the first Supreme Court case I went and listened to the oral arguments when after I had joined Planned Parenthood. But Anthony Kennedy writing the majority opinion that upholding a ban on abortion procedure wrote, while we find no reliable data to measure the phenomenon, it seems unexceptionable. This is from your book, to conclude some women come to regret their choice to abort the infant life they once created and sustained. Severe depression and loss of esteem can follow. I remember being in the court while the arguments were being made and having, at that point, there was only one woman on the court, Ruth Bader Ginsburg, this, frail, feisty woman literally carrying an entire gender on her back, and having men on the court talking about the difference in dilation of a cervix, literally almost getting out, medical instruments, and how outrageous it is to think that they would be making these kinds of statements or kinds of, just feeling free to weigh in on things they actually had no information about. So what'd you find out? What would you say are the big takeaways? Obviously people want to read the book to get all the stories, but yeah.
So we first focused on mental health and using careful measures to measure women's mental health, both before the pregnancy and then through time. And also because maybe abortion doesn't cause mental health problems, but maybe it causes a range of emotions. We also asked just how women were feeling. Mm-hmm. And if you ask women about why they want an abortion, they rarely give mental health reasons. They give reasons that have to do with the circumstances of their lives. Their worry about being able to support a child or take care of their existing children or have a strong relationship. So we asked about all of those questions, all of those outcomes too, and compared both groups of women, the women who received an abortion and the women who are denied. And what we found was, I think surprising for people on both sides of the debate, is that over time, the mental health of the two groups were the same. So whether they received an abortion or were denied, women showed the similar levels of depression and anxiety. And that's not because both groups were so miserable. In fact, people did better over time. On the other hand, there was short-term elevated depression and anxiety for people who were denied. So to the extent that there's mental health harm involved in abortion, it's from denying women abortions, mental health harm in the short term. And the other, big finding from the study, so if people have seen the study in the newspapers, the big finding is that women who have abortions don't regret having had abortions. Over 95% at all time periods say it was the right decision for them.
Right. Well, and another, go ahead.
Oh, I was just going to give away more results. Where there were big differences in all the reasons that women said they wanted the abortion. So the economic trajectory of the two groups diverged substantially. The physical health consequences of carrying a pregnancy to term and delivering are just so much more serious than of having an abortion. And so we saw long-term economic and physical health differences.
Sorry, I know there's a little bit of delay, so I jumped in too early there. But we were talking earlier about this, that your, I think, overwhelming sort of, at least to me, it sounded like a conclusion. I want you to put it in your own words, is that women make careful decisions, or pregnant people make careful decisions, which again also kind of undercuts, I think, the mythology. And we talked a little bit about, the whole idea of trusting women to make the best decision for themselves. And Dr. Tiller, is that what you found? And again, I think the other piece of this, which of course most people probably aren't aware, is how many people who already have children have abortions. So that it is, and that's quite, I think that's also something that is that people don't know. Yeah,
I think it's part of a whole picture of talking so abstractly about the issue as if it's a moral debate that we should all discuss without talking to the people who are pregnant. And this book maybe will open folks' eyes about what the experience is and what the process of making the decision to have an abortion is. Because without thinking about why women would want to have an abortion, it's very hard to think that they would be able to make that decision, that you would trust their judgment. And that really is one of the most important findings from the study, is that people, when they're making this decision, have reasons based on their own life circumstances, and their concerns are valid, because everything they're worried about, their relationship not being good enough, we see that the relationships with the man involved erode regardless of whether the pregnancy is carried to term or not. So they're making careful decisions. And so a lot of the kind of patronizing laws which ask women to spend more time or see an ultrasound are really not necessary. And as you said, 60% of American women, and women in this study as well, are already mothers.
Right. Yeah. I mean, I certainly saw when we used to see that at Planned Parenthood every day, women making the very best decision that they could. And maybe we should have nested this conversation in this incredible moment that we're in of a long overdue conversation about racism in America, and of course the murder of Black people and the criminal justice system. And one of the conversations that doesn't happen as much is the discriminatory, the reality of our healthcare system, or lack thereof, and that includes reproductive healthcare access. Of course, we were seeing it with the COVID pandemic, the disproportionate impact on the African American community. I'm curious, and this has obviously been, the roots of this conversation really go way back, but certainly the reproductive justice community has been in the lead for so long in lifting up the disparate access, and how also all of these punitive laws disproportionately impact, women with low incomes, women of color, women in rural areas, and of course, depending on where your zip code is, so dramatically impacts your ability to access abortion, safe and legal abortion. So that's a lot, but what would you say are some things that we should know and that you write about in the book about how being turned away affects different women in different ways?
Yeah. So this book is really the story of what happens when people can't access abortion services. The reproductive justice movement that you alluded to is about what was started in 1994 in Chicago. A group of African American women gathered, and they started this movement to try and broaden the picture of reproductive rights to include both the right to have an abortion, but the right to carry a pregnancy to term, and to parent a child, and to parent a child in a safe environment, which is even more poignant, I think, or today. So this book touches on one small piece of it, which is what happens when people can't get the abortion they want. And rightly, there's a bigger set of issues about being able to have the children that you do want and parent them and have them grow up to be adults. Right. The safety aspect. But everything that the Turnaway Study found in terms of increased physical health risk from carrying a pregnancy to term, the greater chance of poverty, the lowered other life opportunities like achieving aspirational life goals or having an intended pregnancy later, all of those were true for women of different racial ethnic groups. It wasn't that white people do fine and Black people don't do fine, or vice versa. All of these are burdens for everybody. And the problem is that access to contraception, access to abortion isn't fairly distributed. And so low income people have much greater barriers to getting care. And anybody who, a minor who has to travel 70 miles but doesn't have a car is just at a humongous disadvantage in trying to access care. People who rely on public insurance. We have a Hyde Amendment, which bans federal coverage for abortion care, which affects federal employees and the military and low-income people with children and disabled people. And that ends up disproportionately also burdening women of color.
Yes, I mean, the whole healthcare system, I mean, this is just as you say, this is just a microcosm of such a much bigger problem. And I want to encourage folks, I'm actually seeing a few people I know making comments. Hi, Deb Vanderhei. Wow. I'm so honored that you're on this call with us. And I'm sure others, if I could read that far. But I just want to also encourage people, if they want to put questions in at some point, we'll get to that. I was going to skip around because one of the questions I know we were going to talk about is just why we don't use, well, the importance of having empirical data, of having scientific data, which obviously from Justice Kennedy's comment in that last part is a classic example. And it's interesting. And this is like a case that I would love to get your thoughts on too, since we know there is an important pending decision coming out of the Supreme Court. But 4 years ago, when the Texas case came to the Supreme Court, Whole Women's Health, challenge to the abortion bills, or abortion legislation, the most recent abortion legislation, since of course in Texas it's something that the legislature specializes in, and the importance in that. I mean, the difference actually in that Supreme Court argument from the first one, where we had one woman on the court and justices making decisions without empirical or scientific data, and fast forward to the Whole Women's Health argument, where there were literally 3 women on the Supreme Court. And as I said to you, Justice Ginsburg in the middle is one of the senior members of the court, but then flanked on the two ends by Justice Sonia Sotomayor and Elena Kagan. And it was literally the attorney from the state of Texas trying to argue the case, which is literally like whiplash, because they were just on it. But the most important thing to me about that Supreme Court argument was, one, of course, having representation a little bit on the court. And that made, of course, these women were outsized in their influence. But the most important piece, too, was research that Dan Grossman had done and others had done about the actual impact of the law, not what was the idea of the law, which was somehow to protect women and this and that. And that data was everything, in addition to having women's stories, real lived experience. And of course, Justice Ginsburg then quoted the data and used it in the argument. Anyway, maybe we'll go back, the whole argument over women in El Paso, and having that data was so valuable. So what do you think is the future of, I mean, this, not only is this book great, it just is such an important piece of writing, but obviously it gives data that is so critical as decisions are being made in courthouses and in legislature. So how do you hope this is going to be used? What do you think the future is of actually using real scientific information instead of just people's political attitudes to make decisions?
I'm going to ask you your answer right after, but my impression is that Whole Women's Health versus Hellerstedt case that used Dan Grossman's data was just probably the best day ever for people who study abortion, because it said state legislators can't just make up reasons for passing restrictions. Those restrictions have to actually have some basis in reality. They have to show that the benefits of the law are going to outweigh the burdens of the law. And so everyone who even has thought about studying abortion celebrated, because we thought, oh, look, our data will finally be paid attention to. And the interesting thing is this next Supreme Court ruling, June Medical Services versus Russo, is considering the exact same restriction that Whole Women's Health versus Hellerstedt. And so if they rule differently, it will send a message that, in fact, now we don't care about science. We just care about ideology, and the empirical consequences of policy on real lives of people don't matter. We see it with the coronavirus too, that politics is somehow trumping scientific study of people's well-being. And but maybe we have an election coming, maybe things are different. So what do you think about the power of data to change the direction of our country?
Well, you're more hopeful than I am that state legislatures, just starting from that point, are now going to believe they have to use data to pass laws, because obviously we've had, and thank goodness we've had so many laws declared unconstitutional or illegal, but legislatures continue to pass them. But I think it is exciting to have the information that is indisputable, so that as legislatures or Supreme Court justices are making decisions, they can't do it by just making up their own facts. But we're not living in a fact-based time, and I think that, obviously we've seen that over the last 3 years, last 4 years, whether it's on medicine or whether it's on climate change. But I just think it's still important to continue to look for the facts. And actually, it's interesting, this Louisiana case that you were talking about, which I hope everybody on this call listening or participating knows, it literally is redeciding Whole Women's Health. And it's going to be critical what happens here. And not only would the court be deciding facts don't matter anymore, they would basically be deciding that precedent doesn't matter either, since they just decided the exact same fact basis. But I think what I would say is, I think it is important to have the data and the facts, and it's also important that people organize and fight, because and I think I would say the same to Dr. Grossman, which was his data, and the data that came out of Texas was critical, as was the fact that people kept organizing and fighting back. And obviously there was a historic takeover of the Capitol in the filibuster by Senator Wendy Davis, and all the activity that continued on. And women, to the point of your book, women told their stories, and places like the Texas Observer and the Texas Tribune told what was happening to women that were now going across the border or seeking other means to have an abortion that they were being denied. And so I think the important thing is facts and science matter, as do all these other pieces. And then of course, Supreme Courts, judges, they factor all of these things. Where's the public sentiment? And so we can't rely on science alone, but we can't ignore it. And so I think that the most important victories we have are when all of these things, kind of come together. I am curious.
Another
sure.
question. I know that since you left Planned Parenthood, you started Supermajority. Could you tell people a little bit about it? And I know that you went on a listening tour, so I would also like to know what sort of role you think abortion and reproductive rights will play in motivating people to be more active politically.
Right. No, it's a great question, and I was just emailing with Tressa Undum, who many folks on this call may know, but has done some of the most important and continues to do research on the impact and how much all of these restrictions are actually penetrating into the minds of the American people, that actually can remember what's happening. And she did some interesting research for us last year on this. What we heard from women, both through data, verifiable data research through a pollster, as well as on the ground, is a deep concern. And I'm going to put it in a broader context than simply the right to safe and legal abortion, but a sense that the government was beginning to take people's rights away, and that abortion was a good example of something that people believe and have legitimately believed was an established right, that it was a constitutional decision or decision by the Supreme Court more than 40 years ago, and that if the government could now say that's no longer a right, then what happens to everything else, including voting rights et cetera. And so I think right now, given the pandemic, giving all the other things that are happening, there hasn't been as much conversation about the state. I think there's not as much awareness of what's happening in states. I do think, as we were discussing earlier, this Louisiana decision, it has the potential, if we all do the work to educate women and voters more broadly about what's happened, and that this Supreme Court, if they do rule, and I certainly hope they won't, I don't believe they will, but if they do rule in favor of the state of Louisiana, it's really, all bets are off. And again, we are going to move to the kind of state that I think this president has and the Senate has imagined, which is a state where your right to safe and legal abortion depends on is going to completely depend on where you live. And of course, for many, many women, as you know, that's already true. And it's certainly true in the South. It's certainly true for women who live in communities that are already underserved. I'm watching our clock. Anyway, supermajority, quick story. Just the idea is we just got to get every single woman we can registered and out to vote. Okay, can I ask you another question? And then I'm going to try to read. I know folks have sent in some questions, and I want to be, so thank you for that. I'm just curious where you think abortion research is now that you've done this really comprehensive study. Where is it, and what else needs to be studied that would help us all in being advocates for people who need access to abortion?
Yeah, there is a lot of really interesting research. Abortion research has taken off in the last 20 years. There's something now called the Society of Family Planning that is 900 scientists and clinicians, physicians and nurses who are interested in who do research on contraception and abortion, and are making it so that doing work on what is one of the most fundamental and common services that women and trans men need is rigorously studied, and is not advocacy, but is empirically studied. And even at my university at UCSF, there's been tremendous growth in kind of trying to get clinical scientists and social scientists together to tackle these really complex issues. And where does work need to be done? The Turnaway Study is really important because before it, there just wasn't an understanding that when you pass restrictions, some women take abortions and their whole lives are changed as a result, and the well-being of their children are changed. But that didn't solve all open questions. No, there's still some more. One is that there are over 900 restrictions passed by states in the last 2 decades, and surprisingly little done to understand what the impact of each of those is. There's in the coronavirus pandemic, are women able to access care? And I know I just learned that across the South, there were big shutdowns and people couldn't access care because of the sheltering in place. This Turnaway Study recruited people who made it into an abortion facility, but lots of people never make it. They might want an abortion, but they can't get there, or they can't raise the money, or they can't get the support they need to get there. And so we don't even know how often that happens. So trying to gauge who isn't served by our current patchy system. And I think that some people may be able to serve themselves people can order medication abortion pills online, and we don't really know exactly. There was a great study where they ordered the pills and tested them, and at that point all the pills were the right pills, but are they still all the right pills? And what information do people know, and what's the most sensical way to give out medications so that we don't have unnecessary obstacles that don't make sense and put make people stay pregnant longer than they want to, and really end up hurting people's health.
Right. Well, I thank you for everything that you all do at UCSF, because obviously just it's invaluable. So I'm looking at a couple of questions that people have asked. One that I think actually sort of started getting answered, but that Rana answered, but I think it's actually interesting maybe for folks. And that is, can you talk a little bit about your methodology, like how you found your subjects from, where were they from, what part of the country, how did you navigate interviewing people? And I know we talked about this a little bit, but anyway, I'm sure folks would be curious to hear.
Yeah. So this study, we recruited women from 30 abortion facilities across the country. And we picked those facilities because they had the latest gestational limit, the latest limit in pregnancy that they would provide care of any facility within 150 miles. So the idea was, if you're too late there, there's no one nearby who can help you. And from each facility, these facilities were across 21 states, and they served, the women in the study were from 40 different states because many women have to cross state lines now to access abortion care. And we found that at each site, we recruited one woman who was just over the limit, two women who were just under the limit and received an abortion. And because in America, over 90% of women who get abortions are in the first trimester, but most of these facilities had limits in the second trimester, we wanted to know, well, are these women's experiences typical? So we had one woman in the first trimester. So for each woman denied, two women who received in under the limit and one in the first trimester. And we ended up recruiting just over 1,000 women. And we had these amazing interviewers who call them every 6 months to ask them a whole set of questions, which were mostly not about the abortion. They were about how the woman's life was working out. And we called them every 6 months for 5 years. And so we got, one of the things we wanted to know is, how often do people think about their abortions? And that's tricky because we're calling them every 6 months. So we really tried not to talk about the abortion much. And we asked that question, and a lot of people said things like, well, I only think about it when you call me. So it's not necessarily a big traumatic event that people dwell on. People move on and do other things with their lives.
Right. And that was certainly our experience at Planned Parenthood. There's a couple other questions. One, I guess I just have to ask it because I'm a Texan, and it just constantly amazes me that every time I think we've heard it all, they come up with something else extraordinary. And of course, this was what happened during COVID and the ongoing battle over whether or not women could actually access abortion in Texas because of some really unbelievable argument that somehow it was not an essential service, or it was not, it could be limited. So what do you think about that? I mean, do you have some thoughts about any of this? I know this is really mainly like legal questions, and it is access questions. This question too is like, now that the number of infections in Texas is spiking, I'm worried that Governor Abbott will re-ban abortion. Although I think Governor Abbott will deny that there are more COVID cases. But anyway, I don't know. Do you have any just general thoughts about this? It was amazing to me that they tried to use this in states as an excuse to shut down access. I
mean, I view it as sort of a failure to communicate what abortion is, that people could decide for someone else that it's not essential. And I'm hoping that, and I don't know how many people who have the view that it's not essential will ever read this book, but to hear from women about why they make the decision and their considerations and their responsibilities for many other people in their lives and their aspirations for their own future, and how actually receiving or being denied changes all that trajectory, all those trajectories. It's hard not to see abortion as essential for the people who are able to get it. But I think, the level of thinking is kind of shallow, and that perspective is not thought of to declare that it's like a trivial decision or an easy thing to just ban.
Right. And I think one of the other additional problems we have in states like Texas, and obviously this is what the Louisiana case is focused on too, is that the lack of understanding of how safe abortion is, how it's done, what access means. Now that, of course, they've made us, the state made healthcare providers build these, basically mini hospitals to provide the service. It feeds into that misunderstanding about what it means. And someone I noticed here, thank you for writing this, how is the tattoos are essential and abortions are not anyway, but that's a very, right on. But I do think that it's part of the whole mythology about what it takes, and that it would either take away vital medical personnel, or, as we know, these doctor referral laws that somehow this, the importance of having admitting privileges in emergency rooms, it just adds to this total misunderstanding about abortion services.
And a desire to restrict abortions to make it safer without any knowledge of how that it's already safe. My favorite Onion headline of all time is from a few years ago. New anti-abortion legislation requires doctors to scale 18-foot wall surrounding clinic. Because, of course, you wouldn't want a healthcare provider that couldn't scale an 18-foot wall. So, Of course, that should make it safer, and it's not the admitting privileges law that they're currently considering is kind of not more absurd than that, or not less absurd than that. It's equally absurd, because they're asking physicians to get admitting privileges at hospitals, and the doctors don't have enough complications to warrant needing to treat people inpatient on an inpatient basis. So they'll never qualify, because what they're doing is so safe that they can't qualify to get admitting privileges. And a lot of the hospitals are Catholic, so of course they're not going to just give admitting privileges. So it's almost as absurd as an 18-foot wall is to tell a doctor they have to go get approval from a Catholic hospital to provide this care.
Exactly. There's a great comment too here, and I see in the comment section, it says Diana would love a book club discussion guide, which is an awesome idea, and maybe that's something that Politics and Prose could help with, because this is a book that is so rich with not only new data and information, but is really thought provoking. And so I think, anyway, like that idea. Here's a question that someone wrote in. Was there one area of life where the difference or consequence between people who received versus did not receive an abortion was most pronounced?
It's the most tragic finding of the Turnaway Study was that we had 2 women who died after childbirth. So of the roughly 200 women who delivered, 2 died, which is a 1% maternal mortality rate, which is 100 times greater than we would have expected based on data from the country as a whole. And it's not that I think that we should say, oh, the mortality rate based on 2 cases is 1% specifically, but that it's a good sign of how much more dangerous it is to carry a pregnancy to term than to have an abortion. And that's because when a woman has to stay pregnant for many more months and go through delivery, there are many more risks. I think that because women regularly choose to go through pregnancy because they want a baby, it's really easy for us to kind of diminish or not see the full physical risks involved. And I know that reproductive justice advocates have been trying to draw attention to the maternal mortality rate among African Americans being many times that of white women, to say that it's how you're treated in society has a big effect on the healthcare you receive and the risks of pregnancy. And these, there's no greater difference than, 2 women who died way too young compared to the women who received their abortions. We had no deaths due to abortion. And those women went on to, have future children at a better time. And some who wanted it went on to have other children. They went on to, be less likely to live in poverty. more likely to report that they were in a quality romantic relationship years later. And so to have your life cut short because you were a few days or weeks late in trying to terminate a pregnancy is a real tragedy.
Right. I thought it was interesting too. This is data that I know has existed, but that so many women who don't have an early termination or have it go into the second trimester are women who just simply don't know they're pregnant, and which I think would also be news to a lot of men. But anyways, there's a question here. Can you talk about the ways the Turnaway Study has been misunderstood and misrepresented in the media on both sides of the debate?
Ooh. I kind of feel like it just hasn't gotten, there's been so much attention on the lack of mental health harm from abortion. Rightly so. That was why the study was started, and every major newspaper covered that. And then we came out with the emotional and decision certainty findings. That was really well covered. And then I thought, now these results for what happens to women's children, their existing children, when they're denied an abortion or receive an abortion, we see actual differences in the well-being of their children. The chance that their existing children live in poverty, they live in a household where there's enough money to meet basic living expenses. We even see differences in the child development. And I thought, wow, we find no difference in mental health and we got all this coverage. Just imagine all the coverage we're going to get when we show that people's children are affected by this. And really, I would say we got almost no attention for that. It just isn't part of the conversation that anybody is having. We're so stuck on the abortion hurts women. Okay, no, it doesn't, but not what is the impact of all these restrictions that actually prevent people from getting care. So I would say it's sort of the most thought-provoking parts really haven't been well covered. The anti-abortion people like one line in one paper. I don't think they've read any of the rest of any of the other papers, but one line that said that women seeking later abortions don't always do so for reasons of fetal anomaly and maternal health. And if I could rewrite that sentence, I would, because it needs clarification. People used it to say people are having third trimester abortions, as if the sentence was about third trimester abortions, but the paper was about women who have abortions after 20 weeks. And so in the later half of the second trimester, some people still don't realize they're pregnant. It may be uncomfortable for people, but this happens. And there just can be a huge physiological response to pregnancy. And when women don't have symptoms, or they continue to bleed, it's just quite possible to not realize you're pregnant. And some women, because so few abortions happen after the first trimester, and with every week it gets rarer and rarer, all abortions after 20 weeks are disproportionately at 20 weeks or 20 to 22 weeks, because it's going to go down every week. And so they use my sentence about, abortions after 20 weeks or between 20 and 24 to try and say, there must be tons of very late abortions for reasons other than maternal health and fetal anomaly. And one more thing about that, which is that I wish that we didn't say that those are the only acceptable reasons for abortion. What this study shows is that when people have other concerns besides fetal anomaly and maternal health, those concerns may be valid too. Those concerns for their existing children, for their life goals, there's a difference in their life trajectories. People have picked and chosen what they want, but the big picture is that women are good at making their own decisions.
Right. What a unique idea. And I can't help but just make an obvious political point, which is all of these restrictions that have been passed, laws that have been passed in state after state, do everything to actually force women later into their pregnancy before they can actually have a termination. I remember being in Texas during all the restrictions when we had so few abortion providers that were still able to meet all the restrictions. And I met a young woman who was driving me somewhere, and as she dropped me off, she said, "Thanks so much. I was so grateful to Planned Parenthood because I lived in West Texas, and I was able to drive the 200 miles to get to Planned Parenthood." And I think, thank goodness she could. But how many women during that time actually could not? And that's not uncommon. Here's something. There's just so many great questions. Okay, I feel like I'm not going to do justice to this. Well, actually, I'll take this one because in case we don't get to another one, it says because the activist in me is too like, okay, how do we now make things happen? So the question here, which of course now has gone away, which is basically what are the next steps and what can we do besides getting you we'll get a book club, reader's guide, but how can folks use all this important data to, it says, how can we translate the data being collected to being translated in increasing access to safe and legal abortion services? This is coming from Ashley. I think this is a question is like, how do we make this actionable? I'm sure you're being asked to speak to all kinds of groups, and but I do think this is the question I feel like women are asking me all the time. It's like, what more can I do? So I don't know if you have like 2 or 3 ideas.
Oh, I was so hoping you were taking a lead on this one.
Oh yeah, I'll do this too. No, I 100%. I'm all over this. But yeah, no, I'm curious to have all that data and then moving it into usable, things that can help educate others.
I mean, I'm moving so out of my comfort zone. I'm a scientist. I would love to collect. Recruit women and to study their outcomes, asking the most neutral, objective questions and do fancy statistics and see how the groups and publish in a science journal and never talk to anybody would be fine. So this book is like so far out of my comfort zone. And then the idea of trying to take it to, I'm looking to you to say how to use this. I would hope that people discuss this and have a new perspective on women's decision making. And I don't actually know how to translate it to any kind of political change.
Okay, we'll figure this out together then. I think that's good. This will be kind of a handoff because I do think that there are just yes, women are dying for information and knowing what to do next. And again, I do think we have an opportunity this next few months to maybe make a change in the direction of the country, and particularly on the issue of access to healthcare, including reproductive healthcare. Okay, I don't know when. I know I don't want to end without making sure I get this. I mean, this is a good question, which would have been a better question for me to ask if I had thought about it, which is there going to be any kind of study or research on how COVID-19 has impacted women? And this said who considered abortions, or I assume also just on access for pregnant people to abortion or anything else. I don't know. Have you all talked about this?
At noon, I had a webinar at my university, led by Sarah Roberts, looking at how what clinics are doing in response to the coronavirus pandemic. And I don't want to jump the gun because it was a work in progress, but it's super interesting what's happening. That was a major shock to trying a healthcare system that was already overburdened. I have my own study of how being sheltered in place may affect women's access to contraception, desire for pregnancy, because the romantic notion that somehow it's like the lights going out in New York and people make at a fun occasion, being locked in your home without access to contraception and losing your job might not actually result in a desire for more pregnancies. So and it's not easy to recruit people right now, but we're trying to find out what's happening to people by recruiting through social media.
Yeah. A comment here, just in case you missed it, from somebody says, "Your delivery is so perfect, Diana. Please realize that you are a very compelling speaker." So you may want to just nerd out on your research, but it's your story and what you know is very compelling. So anyway, there's a fan out there.
Thank you.
I'm just looking to see if there's anything else that, I would kind of like to know what you think about this Louisiana decision and the repercussions one way or the, I guess particularly if it doesn't go our way. Anything that you want to say about that? And also maybe just fill people in. I worry, as I said earlier, that so many people in this country don't realize we're on the verge of this really, really important decision.
Yeah, I think all eyes are going to turn to this topic when the Supreme Court issues its ruling. And I have no idea how the ruling will go. It seems, so clear cut that they're hearing the same exact case they heard just 4 years ago. So how they can rule differently, I don't know. So maybe they won't. And if they do, it really will be, I think, a rejection of the concept of science of trying to use empirical data about the impact of laws on women's lives and people's lives. So I am very concerned about it. It's beyond the 1 million women in Louisiana who will then have only one abortion provider, which will be extremely difficult. Yep. But it could have ramifications across all states.
Exactly, because it really will mean there is no undue burden left almost for access. And so I guess to that point, and to some of the questions earlier, it's going to be critical when this decision comes out that people understand. I think that there's so much confusion. There have been so many, as you know, again, during COVID, so many bad executive orders, efforts by governors to end access to abortion. There's so much legislation that it's very hard for the average person to keep up. So I think it's going to be critical that we explain this decision for what it is, and explain, to your point, that it is so much further reaching than the state of Louisiana. A bad decision would give a green light to folks everywhere. So what else? Is there anything left that you think you want these great folks that are here listening in, anything else that you want them to know about the book? Again, it's great. It seems like everyone here has written that they're buying it or they did buy it. I hope they did. It's compelling because, of course, it is the real stories, the real lived experience of folks. Is there anything else, though, that you want people to know that I've forgotten to ask you?
I would like to give the message that doing research is not a one-woman show, that it is, this work is a collaboration of over 24 scientists, economists, sociologists, psychologists, public health researchers, nurses, who all contributed to analyzing the data, and then a huge team of really compassionate, hardworking people who did the interviews over years. So one of my pet peeves is science fairs, where you have some silly idea, and if you can make the most attractive poster, you win a prize.
Right.
That's not science. Science is trying to collaborate with other people and caring much more about the topic than about what the poster looks like when you're done. And I think we'd have more women in science if it was known how collaborative science can be.
That's a beautiful, that's a beautiful way to kind of wrap this, but also, I also would say a cheer to all the women and people and pregnant people who shared their stories. We shouldn't have to share our stories about our own decision-making, our abortions, our what we do with our lives, but unfortunately it continues to be necessary. And I'm always just, we talked about, and you write actually, I think in the beginning of the book, about women who sitting in a health center, an abortion providing center, and reading diary entries from others. I feel like this is something that people have done for each other for a long, long time, and particularly when the government turns their back on us, or when the stigma that another person had written it about is so tough, or you have to walk through protesters simply to access the health care that you need. So cheers to all the pregnant people who tell their stories and give others courage to do what's right for them.
Thank you. And thank you, Cecile, for leading an organization to motivate women to be more politically active. It's so wonderful and potentially world-changing.
Well, one thing to remember, again, I'm not a scientist, but I do kind of like math. Women are the majority of voters in this country. And so we actually have the ability to make big decisions and make big change. And so I hope that can feel like an empowering thing to do. I know Brittany, I don't know if Brittany's going to come back from Politics and Prose. Also, can I just say something about, we talked about Politics and Prose earlier. I don't know how many of you folks are actually ever been to Washington, D.C., but it's a great independent bookstore. We all in this moment should be supporting our independent bookstores because it is really, really tough. And without independent bookstores, we would only have, I don't know, Amazon or something. So go out, buy books from Politics and Prose, support your local independent booksellers because they're making sure that I don't know, that literature is out there, and particularly stories like this and books like this that need to be available. So thank you, Brittany.
Thank you for saying that. It's so true. Buy from your local indie, buy from a Black-owned indie, especially right now. There are lists floating around in DC. Mahogany Books is great. And somebody asked in the chat if they have friends who want to watch this, or if they happen to miss the beginning, you can watch this event all the way through. You can replay it at this link right here. All people have to do is register on Crowdcast. It's also on our website. So please send the link to friends and other women and men in your life who could really use this discussion. But you can replay it literally at any time. And I wanted to close out in true independent bookstore fashion and ask you both what you are currently reading, what you're excited to read. And just so everyone who's watching knows, I am gonna send a follow-up email with links to all the books that Diana and Cecile are about to recommend. So if you miss them, don't worry, they will be in your email. So Diana, we can start with you. What are you excited to read next?
So there's a new book out by law professor Michelle Goodwin called Policing the Womb, Invisible Women and the Criminalization of Motherhood, which talks about all the ways in which state control of pregnancy and pregnant people, understanding that from a legal perspective and a human perspective. My colleague, sociologist Carol Jaffe and law professor David Cohen just published a book called Obstacle Course, The Everyday Struggle to Get an Abortion in America. And that is full of both statistics, but also stories of just the incredible efforts people have to go through to access care. And finally, there's a book that I happen to have an advanced copy of, but it comes out in October by physician and abortion provider Mira Shaw, called You're the Only One I've Told, The Stories Behind Abortion, where she talks about the people she's met and all the conversations where they pull her aside to say, you're the only one I've told. So all three of those are fantastic.
Okay. I'm a little more lowbrow, so I guess I need to make a new list. Let's see. One book that I have bought and am in partway through, but haven't finished. So, but I know it's great. It's called The Yellow House by Sarah Broom, set in New Orleans. Anyway, really, I think it won a big award too. I love New Orleans, so I like to read about anything actually. And that's another, I just read this kind of interesting series. This is really kind of more in the, just for fun. But a woman named Sarah Gran wrote a triptych of about a woman detective called Claire DeWitt. So I think the first one is Claire DeWitt in the City of the Dead, I think. Also actually in New Orleans. I guess there's a theme here. And then I think like everybody else, I'm reading and rereading important books on race in America. And so I guess there's so many that I didn't, and please check out, there's so many good books, but I really, really, really recommend How to Be an Anti-Racist by Ibram Kendi. It's just, there's no way to, he's an incredible writer. And I think it's there's never been a more important time to understand what it means not just to be not racist, but how to actually be actively anti-racist. So.
Yeah.
Yeah, we have on our Instagram, we have books, both the Lambda winners for Pride Month. We have lots of book recommendations and also a lot of anti-racist titles that are, it's a great problem to have, to be sold out of a bunch of anti-racist books, but you can still get them from us. There's just a wait because everyone is ordering them. And you can order Diana's book by clicking the link below, straight from Politics and Prose. You can do $5 shipping, or you can do pickup if you live near any of our stores. Thank you guys all for coming out, and especially thank you, Diana and Cecile. Like I said in my intro, this is such a crucial discussion that is only going to get more important as this pandemic rolls on. And as we know, healthcare and race is intrinsically tied as well. So thank you so much for this discussion.
So great to see you all. Thank you.
Thank you.
Yeah, take care, everyone. Good night.
Bye-bye.